Good evening. Good evening, everyone. Thank you for joining us tonight for our second of two webinars on menopause for 2025. And it looks like we have a few people in. To remember those that are not able to join live, we will have this available for those who have registered to view on replay at their choice. All right. So let's see here. So I want to talk a little bit about menopause and metabolism. That has been a thorn in my side, or extra weight on my side, should I say, for many years, and for a lot of patients that I take care of. It's been one of the major concerns of patients, and we're going to go over that and maybe why that is, and maybe some ideas of things to do that may help you have an approach toward weight during this time of change. But thank you for joining us. If you didn't get a chance to see the first webinar, it too was recorded, available for people to play back if you were a registrant of it. So you should have gotten an email about that. I want to list out a couple of objectives about what we're going to expect to do today, to cover today. Understanding menopause and perimenopause, right? Oh, there's a typo at the end there. We're going to talk more about how hormones can impact weight and metabolism. We're going to look at strategies that may help us manage weight better during midlife or during that hormonal change or that transition, and explore some lifestyle and potentially medical options that could be used to help manage weight to a certain degree. So what is menopause? We went over this a little in our first seminar, and actually we're trying to recap this in each of our webinars. So it's a natural occurrence in females. You know, if you are a female, this is going to happen to you, just as it was that you started to have your menstrual cycle. Start your menstrual cycle, there's going to be an end to it. Those hormones are going to come to a close for us as we have no need for them to carry on through our after we end our reproductive years. It is defined as 12 months without a period. So total of 12 months. So if you go from January 10th of 2025, have not had a cycle, and you have to go into January 10th of 2026 to say that you're menopausal. The average age is about 51. That age is kind of dropping. It's less than it was from 10, 15 years ago, when it could have been more in the 55-ish range for people. And the range of menopause is 45 to 55 age range. To keep in mind that range varies based on your ethnicity. So African Americans, Asian descent, and Hispanic descent females are likely to experience menopause earlier than the average Caucasian female. That period of time of perimenopause, you know, when we may start to experience those symptoms of hormone change, may last up to 10 to 11 years. So we have to keep in mind that that's a long window of symptoms for females. And that window could be the time that you start to explore maybe what's happening to my body, what can I do to help manage those symptoms better. After the menopause transition has, you've entered that menopause transition, you're actually in menopause, it may open up other treatment options for you to use, especially if you have other ways to protect against pregnancy. So let's talk a little bit about estrogen. So estrogen is one of those ovarian function hormones produced by ovaries. Estrogen, progesterone, and testosterone are the hormones that impact our hormonal metabolism in females. And estrogen major impact is on our bones. It can impact our heart and our metabolism. So bone health, osteoporosis strongly correlated with estrogen's level. Heart health, our cardiovascular risk increases as our estrogen decreases, and of course, metabolism. And estrogen has the ability to help with fat distribution. And boy, have I seen that distribution happen. I can actually now look at women because I know what I used to look at women to know when that, and many women, not all, when that transition has happened because we have a redistribution of weight. Redistribution of weight starts to settle in our abdomen as well as in our hips. Our butt is another spot where that may distribute and settle. And so we'll see our body shape change. Decline changes how our bodies, this decline in estrogen impacts how our body stores energy. So we start to put on more fat than muscle. So as you know very much, is that fat is not going to burn as many calories as muscle. So that distribution or that shift is going to certainly impact our metabolism. I always jokingly say that my metabolism is shifting, but my appetite hasn't. So then we have to look at ways we can impact our appetite to help adjust for that metabolism shift. So why this matters is that about 60 to 70% of women can notice a change in weight during menopause, during that menopause transition. And when that weight, as I said, settles in our abdominal area, weight around our organs in our abdominal area, visceral fat, is a cardiovascular risk factor. So that can put us more at risk for heart disease, vessel constriction, plaque development. All of those things increase when that fat distribution changes. So that is a spot that we really need to work to kind of reduce weight is in our abdominal area. But I must say it is certainly very difficult. That metabolic impact can impact our energy, our mood, long-term health. And I actually see this happening around increasing our symptoms of joint pain too. So when metabolism changes, blood sugar may change, and that can increase blood sugar, and blood sugar can be very inflammatory. Increase in blood sugar can be very inflammatory. So a lot of joint pain could be around this shift in metabolism also. So let's talk a little bit about menopause transition and what that is. Kind of covered this in the slide before, but I'll go into a little bit more detail here. Is that perimenopause is about 4 to 8 years before menopause actually happens. But I mentioned in some it can extend out to 11 years, 10 to 11 years, especially those that are have Asian, Hispanic, and African American are Black descent. And there is a fluctuation in your estrogen and progesterone levels. So during that perimenopause phase, your numbers are going up and down constantly. It's like trying to hit the dartboard with a dart. You don't know where it's going to hit. It may catch you. You may catch that number when it's up, may catch it when it's down. And that's also a fluctuation in our symptoms and emotions during that time period too. Postmenopausal is after that 12-month period of not having a menstrual cycle, and that usually indicates that our estrogen levels are low enough that it's not sending a signal to our ovaries to produce an egg to ovulate. And when that happens, we no longer need to have the ability to keep that egg, that menstrual cycle in our uterine lining thick enough for that egg to implant in. So when that's not happening, of course, you're not having a menstrual cycle. Hormones changes are shifting, and like I said, causing that fat storage to change. I kind of alluded to the fact that that can impact our metabolism and blood sugar and insulin sensitivity. So we have an increased risk of insulin resistance during this time. Of course, that could be a precursor to weight and prediabetes, or diabetes in some cases. It can progress to that point. We also I have a chart here that kind of gives you an idea of how those estrogen levels are dropping. So perimenopausal or premenopausal, in our 20s, early 30s, estrogen levels are up. Of course, what's falling first is the progesterone level. That's this darker line. The blue line is estrogen. Early menopause, that number falls further. Early perimenopause, that number continues to fall. Late perimenopause, falling out. And then you can see those numbers start to bottom out in menopause and further drop in postmenopause. So meaning that your symptoms may not be as evident here. You may notice this drastic drop and you may notice a significant increase in symptoms during this time. And then those symptoms start to plateau, meaning maybe not developing any new ones and or those symptoms start to transition from one to the next or one phase to the next. So you may end up having more or less hot flashes out here because that drastic drop isn't happening, but you may have more vaginal atrophy or vaginal dryness in the postmenopausal phase after a period of having a lower estrogen level or lower hormone change, lower hormones, both estrogen and progesterone. This is a depiction, and I shared this in our presentation from last month also, but it shows you where those estrogen levels are higher. And you could see that estrogen does seem to surge, and then it starts to fall off, right? And some of that surge is actually in that perimenopause phase. So that could present with more symptoms around irritabilities and breast tenderness during those phases too, as we're trying to support symptoms females are having as that hormone change starts to set in place. But you can see down here in 75, this very small amount of hormones, a very small amount of estrogen is present during that time. That would be well set into postmenopause. Then here we also have a guide that talks about that distribution of weight. Like how does your weight change during that time? And I want to take a moment to stop and set some ground rules too. So to know that you will have the ability for question and answer at the end, but you can also enter your questions in the chat or enter your questions into the chat also. There may be a spot that you can access this question and answer, but we may be able to see those quicker in the chat. All right, so again, looking at this graph is telling you that cumulative weight change over around menopause onset. So the 0 line is menopause, but you can see that a lot of the weight has already started to happen well before your menopausal years. And it continues because remember that that fat distribution is going to set in place, and we're going to also start losing our muscle mass, making it difficult to maintain our weight. So we'll talk a little bit more about what you can do to help offset that change in the slides to come. Our next slide is going to show you, hopefully, there we are, an idea of where the most of that weight increase happens over the perimenopause and menopause years. So it's broken out into every 5 years or so. So early 40s, there are some changes in weight, but you can see those numbers start to really increase. And really, most of that weight gain is centered in that 50 to 54 age range. And that's around the time that menopause is really setting in for many women. Many women could have already had it happen earlier. Very few people have it happen afterwards, but I do have a few patients that are in their 60s that have not been considered menopausal yet because they're still having regular cycles. And there are majority of that weight gain is going to happen in the 50s, that first half of our 50s. And that's certainly, I probably had most of my weight gain in that, at that 50-year-old mark. Yes, it was probably certainly right around that time. I certainly fall into that category, as does many of my patients, as do many of my patients. And to say how much weight gain, that totally depends on patient, the person themselves. It's very individual. So there are some that have very little, And there are some that can have a lot just in a 1 year period of time. And it's hard to gain control of that weight gain, and it's hard to turn the dial to go back in the other direction after that weight has distributed. It takes drastic changes to cause that shift to happen. Drastic changes in lifestyle. So hormones and metabolism. So as estrogen declines, you can have a decrease in your resting metabolism rate, metabolic rate. And again, that is as a result of a shift in fat distribution, or the ratio between fat and muscle. And that fat starts to distribute itself in places that doesn't lead to great cardiovascular or health benefits for us as females. So we really have to be cautious about where that fat settles. And when we see that happening, to know that we need to intervene to cause that shift to move, cause that to shift so it has less likelihood to increase, because the more of it that's present, the harder it is to get that number to return to baseline or near baseline. So remember that fat or weight that happens in our abdominal area, it's going to be some of the riskier weight that we could put on. So hormone changes can impact that weight gain. The amount of muscle we have on board can impact that weight gain, or our weight. Lower activity levels can impact our weight. Lifestyle and stressors. During that hormonal change, we have a lot of stressors. Our stress seems to escalate because we have a lot of concerns about what's going on with our body. Oftentimes during that period of time, we're kind of in a tug of war between caring for ourselves, our family, our parents, and our immediate family. So a demand on our time is increased. And that's on top of any responsibilities that you may have within the workforce. The other thing that I think we should, that probably I should have included in here, that can impact weight gain is, again, that decrease in metabolism and our appetite not changing. Of course, my appetite has remained the same. So I need to kind of shift. I would then need to shift what I'm eating to things that's going to be harder and going to be more complex and difficult to digest, so it can help me to stay full longer, so I can feel like my appetite is satiated for longer periods of time. And the other component of weight gain that could certainly lie within here is those metabolic things that set up around prediabetes and insulin resistance that could make people make it more difficult, more challenging for women to have a decrease in weight. Another risk factor that we should consider for females, because it's certainly very prevalent in the female population, is around PCOS, because there's already predetermined metabolic condition that's in place, and it's kind of exacerbated. So those women who have already had the precursors of metabolism issues, it's only complicated during the menopausal years in many of us, or many of them. Abdominal fat. So we talked about that risk. So a waist circumference that's more than 35 would lead to increased risk of these things. So thinking about diabetes, type 2 diabetes, that's the adult onset diabetes, that can lead to more of an increased risk of insulin resistance, which can be a precursor to diabetes, heart disease, right? Certainly, and then certain cancers, because as weight increases, we end up having more cancer risk increase. The other thing that I wanted to point out is that when we have increased weight in our abdominal area, you may start to have more physical symptoms present themselves too, like heartburn or reflux, have more problems with sleep apnea, because weight in our abdominal or in our truncal area could lead to risk factors around both of those, putting pressure on our stomach and esophagus, as well as having more weight for our chest to our breath to lift, for us to have a good deep breath through the night, leading to sleep apnea. All right, so boosting metabolism. So how would we go about that? Right, that's been probably the question of the day, but I must tell you, ladies, there's not a magic pill, there's not a magic injection that's going to make that happen for a long-term period of time. But what it's going to take is a change in our body's metabolism of our nutrients. So that's taking on eating more protein-rich foods, high fiber foods, and we want to reduce and limit sugars and carbs because the goal of this is that we want to make things more complex for our body. We want to make sure that when you ingest something, that your body's going to take a bit of time to um, get it metabolized, or it's not going to drive blood sugar up quickly. So say, for instance, if you had a choice of a cracker or a palmful of almonds, it would be better to choose a palmful of almonds because it's going to have protein and fiber in those almonds versus a cracker. It's going to be easily digested and it's going to drive our blood sugar up quickly. Keep in mind, if blood sugar drives up quickly, we can't burn that off very quick. We can't get rid of it quickly enough as quickly as it increases. So you want to do things that's going to drive blood sugar up at a gradual increase versus a drastic, sharp incline. If you're doing that sharp incline, your body is going to say, oh, I don't need all that glucose. I don't need all those calories. Let me store it. Let me store it away for a rainy day. And you know where it's going to get stored? It's going to get stored in our abdominal area. And, I know I don't need it. I know there's been lots of rainy days, but I don't need any storage for a rainy day. I have plenty of storage in places that my body could use. And I know that I'm going to have food at a later time. I'm not going to starve as a result. Exercise is another major component to help boost our metabolism. So strength training. So we want to make sure that we're building our muscle. Muscle is a way to grow that muscle mass so we can have a shift in our fat and muscle ratio. And remember, menopause is going to cause a decrease in that muscle mass. So we almost need to have a running start to kind of get over the hurdle to offset that drastic decline or that decline in muscle mass that can occur in our menopausal years. Cardio is very important also, but I seem to focus more, my body type seems to benefit more from strength training as the majority or the priority of my exercise. So I usually prioritize strength and then fill in with cardio. So, and the cardio that I choose to do is a cardiovascular exercise that's going to really poop me out. I need to be out of breath. I need to not be able to carry on a conversation when I'm doing it because I need my metabolism. I need that glucose to be, our cells to be hungered, have a hunger for that glucose so it can push it into the cells to utilize. It's also important to make sure that we're improving flexibility. Our joints can become more stiff in our menopausal years, and the risk of falls or having an osteoporotic break as a result of falls could increase as we get older. So I have people focus on balance also. Prioritizing lifestyle. So working on managing our stress. I am a person that needs 8 hours of sleep or more. Some people could live with fewer hours. And to know that during those menopausal transition years, our sleep is very much compromised in many cases, oftentimes related to not being able to settle our brain down, or hot flashes, having aches and pains through the night. So we need to make sure you're doing what you need to do to help manage sleep to the best and the safest way for you. Managing stress seems to be an easy solution, doesn't it? Seems obvious as a solution, but it can be very challenging during those years. As I said before, we're kind of stuck between caregiving for our parents, caregiving for our offspring or our children or our siblings, as well as trying to care for ourselves, all over top of our usual responsibilities in life, whether it be working in the workforce or doing things of your enjoyment. Strength training, muscle mass. So alluded to this before. Remember that muscle is going to burn more calories than fat, even at rest. So your goal is, or my goal is to have enough muscle on board that I could burn calories like I used to in my 20s, just sitting down, It didn't take much to maintain my metabolism. I could skip a meal and drop weight like that because that balance was tighter toward muscle mass. Now that I have more fat on board, weight doesn't move nearly as quickly as it used to. Resistance training preserves bone density. So that means that your muscle mass, building strength, can help keep your bone strong. So those people who have bone densities that are low, that's going to be very important to kind of help maintain what you have and grow. And it's important for those people who have family history of osteoporosis or osteopenia to make sure that you're maintaining that bone mass. And menopausal females or women in general to make sure that we're not putting ourselves at risk for bone loss. Typically, I recommend people most sessions, I mean, most days of the week. In regards to exercise, our slides say here 2 to 3 at the minimum per week. In regards to exercise, both strength and muscle mass training, strength training and muscle mass building. Let's talk a little about nutrition. A couple of targeted points to note here is that we want to make sure that we're having, I tell people, real food, whole food, things where you know where it came from. You don't need things that have a lot of ingredients in it. You need to be able to see that it's simply food that you can understand where it originated from. The Mediterranean diet is actually a very good diet plan to follow. It really helps to increase your omega-3s, which are good for inflammation. It keeps carbs more on the complex side and fewer of them. And it also helps, and then as a result of that, it helps to keep that storage of fat in the abdominal area low. Lean protein with each meal. I usually try to keep my protein intake higher, followed then by my vegetables, and then followed by carbohydrates. And patients of mine know that I say we really need to watch our carbs and sugars. And I still say that, but it's not to say that you cannot have carbs. Carbs are going to be an essential part of a nutritional diet for us. We just want to keep them limited to the point where we're not, and keeping them limited as well as making sure that they're complex in their origin so we can burn them off very slowly versus very quickly. We want them to stay in our body or not cause our blood sugar to drive up very quickly. You want it to go up in a slow incline. Healthy fats and omega-3. Some of my favorite things to do is omega-3 supplement because it really helps to control our inflammatory response, but I also like to have it in my diet. I have had some good suggestions from dietitians and nutritionists from, of course, salmon and tuna, some of my favorites, almonds, walnuts, as well as I've dabbled a little bit about edamame, which is a good protein source and healthy fat source. Avocado is also a good omega-3 source too. You have to be cautious because it can be packed with calories, but it is good with healthy fat, fiber, and protein. You want to have a fiber intake that's at least 25 grams daily. Very important to do, but very difficult to do because our diet is filled with things that have small amounts of fiber per serving. So some people choose to take a supplement to kind of boost that. Keeping in mind that fiber-rich foods are going to be things that's going to cause your blood sugar to rise slower. So having fiber with each meal is going to have a fiber-rich meal is going to be good at helping regulate that blood sugar post meal or with our meal. I've had some people choose to do a little bit of some additional fiber supplement to their usual diet of vegetables and protein, just to make sure that they're boosting their fiber intake. Let's see, I think I skipped there. So I think that kind of sums it up, and we'll move on to the next slide. The role of hormone therapy. So many people think that hormones are going to be the magic, right? It's going to cause us to cause a drop in our weight, but that's not necessarily true. It may help us improve insulin sensitivity in some women, but that's not going to be something that's going to be across the board for people. It may help to reduce the amount of fat we have in our abdominal area in early menopause, but in people situated well in menopause, that's going to be more of a challenge to do. It's almost like I said, you need to have kind of like a running start to kind of make sure you have enough momentum to carry yourself through the menopausal years. And that hormones are not going to be a weight loss medication. It's not going to cause us to, it cannot be used to cause weight loss. It's not going to cause a significant amount of weight loss. That's going to be the work of us as in regards to lifestyle. So that's our exercise and our nutrition. It's going to cause that. Insulin resistance is a major component to weight gain, as I mentioned before. And there are modalities that can help women who have been shown to have insulin resistant or pre-diabetes to help them shift that insulin sensitivity to something that's more productive for their metabolism. So maybe worth talking to your healthcare provider about that if you are in that category. Realistic expectations, so to know that it's not going to be a miracle, nothing is miracle. Our body is not the way it used to be. It's never going to go back to 20. I know now that my knees are not 20 and my weight is not that of a 20-year-old of me when I was in my 20s. So I had to come to acceptance of that and know that this is my new body and I need to approach it and love it in that way. So that's what I encourage most people to do. You want to focus on your strength and energy, and looking at how you feel in your clothes versus what the scale says. I think that tracking your waist size and how you're improving through your physical activity, like how your endurance is building, is a great way to focus on your progression along that journey. I was recently had the privilege to see the Venus de Milo statue in person. And listening to the tour guide describe Venus de Milo. And, this is a statue that was from over, I'm thinking, like in the Greek years, Greek artist is who designed this statue, right? Or from ancient times of Greece. And heard the tour guide tell us that her body size or her size, of that statue represents a person that's a size 14, so she's a very curvy person in statue form, right? So that has been a size of a female for years, well beyond us, so we have to understand that at this phase of life, we're going to have curves in places that we haven't had before. And as I said before, I've had to come to adjust my perception of my body during these years so that I can appreciate the phase of life that I'm in, all while trying to focus on maintaining a healthy mental attitude around my body, as well as an attitude toward fitness and nutrition. I wanted to make sure I said that because I thought that statue kind of summed it up, is that a size 14 was considered beautiful. And I think that's in media today doesn't always represent the same. Some myths is that weight gain is inevitable. That's not necessarily true. It certainly can be managed, but through those lifestyle measures are going to be the way that is going to give you that running start. Again, in certain instances, other methods could be used to manage weight too, but that's something you should carry on a conversation with your healthcare provider with. Hormones are only the cause, it's a myth, but lifestyle matters too. So the lifestyle around how we exercise and feed our body are going to be important in maintaining our weight, and nothing helps. I will say that it may feel like nothing helps, but it's going to take a lot of effort and work to get that scale to move to the other direction. Not saying that there are not options that are out there, but those are very individual to the person that's experiencing that weight change, but certainly worth having a discussion about. Lifestyle things to consider. Balanced meals with high protein. We talked about that. Having regular exercise, especially focusing on strength, prioritizing sleep and stress management. Remember, I'm an 8-hour person, and if I'm getting anything less than that, it may not lead to a great day the next day. And have a conversation with your healthcare provider. Let them explore your concerns around weight and help look for metabolic things that can be contributing, that can be addressed in other ways. Having a conversation with a dietitian, nutritionist is also a great way to explore things that we may not have considered. I only know as much as I know, that I've come in contact with, that I've experienced in regards to nutrition ideas, new things or ideas around nutrition. All right, some key takeaways to keep in mind is that menopause affects our weight and our metabolism. That's an obvious. Of course, hormones are impacted, lifestyle is impacted, and it's a part of our aging process. It doesn't have to be that it is a hazard to our health. There are things that we can do to help mitigate that risk around our health. Healthy habits and treatment options are out there, have to be tailored to that individual, but certainly worth having a conversation with your healthcare provider about. So this is going to be the start of a little bit of interactive component of the presentation, and maybe people could put things in the chat to respond to this. So the first question I have is, what's been your biggest challenge with weight in menopause? I know mine has been accepting that I'm not going to get back in those clothes that I was wearing 5 to 10 years ago, because that was a different phase in my menopausal journey. And I have weight distribution that has set in that's not going to allow that to happen. My days in a sheath dress are gone. Yep, those sheath dresses have to be turned over to a consignment shop. Let someone else have joys with them. It tore me up to get rid of them because I had to accept the fact that that may be a different phase of my life, and I have a different body shape now. Let's see. The other question that I wanted to ask is, what's worked for you so far? Have you had any success in things that you're willing to share with others? Of course, there's many options out there. I know that what has worked for me has been around working with a personal trainer to help me work on building my muscle and working my muscles to the point of fatigue. I must say, I'm not a person that likes discomfort. So when my muscles are tired, I'm ready to stop. I'm ready to say, let me give myself a break. So I'm apt to stop working out in discomfort. So I need someone to tell me you must continue in order to make that threshold. All right. And thinking about what could be your favorite healthy snack. Anyone have anything to share? My favorite healthy snack has been edamame. I am a almonds fiend. If anyone has seen me, they know that I talk a lot about eating nuts, but that's been a quick, easy snack for me. I am a person also that doesn't do well or has not done well. I do better now with missing a meal. So intermittent fasting hasn't always worked for me, but that does for some. Intermittent fasting. And people have to choose a plan that works well for them in regards to that eating and fasting window. And oftentimes that can cause a shift for people in weight, in metabolism with intermittent fasting. People have found benefit in using a continuous glucose monitor at times to kind of trend and track their blood sugar throughout the day to let them know what things have an adverse effect on their blood sugar. A blood sugar that's higher, of course, is going to lead to those extra caloric calories around for your body that your body would want to store for later. So you have to be careful around that. All right. Oh, and my apologies, because I see that there have been some things in the chat. I just opened that up. And I'm going to go through some of those questions as we see. And actually, maybe I'll start at the bottom just to see if there's any of those things that people have mentioned in regards to eating that could be a benefit to others. So one of the things is having an accountable partner to help with getting to the gym, so that's important. Kefir granola, strawberries, a nice snack. Yes, high protein snack, that sounds like. I would probably wonder about adding some flaxseed or chia seed in there too for good omega-3s and some additional protein. Um, and um, and kefir with overnight oats. So that's a good snack or even breakfast for some. Let's see, what else do we have here? We have seaweed replaces potato chips. Yep, that's a good choice. I have tried making kale chips also. You can do that yourself. You got to be careful because they cook up very quick. Let's see. Walking a lot, using anti-inflammatory diet or gluten-free diet, also good. Mixed nuts, as I told you, I am a nut fiend. Nuts and carrots. Carrots are a good source too. Has lots of fiber, that crunch, I think. Using a couple of apps, people listed, my FitnessPal app, TD50, TDEE 50 is another app it looks like for walking. Um, let's see, we're going to get back to hot flashes, Miss Hendricks. Low energy, workout is hard. Yes, yes, working out is hard without energy is low, which can be a result of having more, sleepless nights. I found that making sure that vitamin levels or vitamins are adequate, my D's and B's, that may be something that you want to explore with your healthcare provider to make sure that that's adequate for you. Let's see. We have a weighted vest someone mentioned to see if that can help reduce reduce their weight and increase their muscle mass. What supplements could be best? I'm a big fan of omega-3s and magnesium. I mentioned about B's and D's being important in regards to energy. Inflammation too can be a drainer of energy. We have to keep that in mind. So working on anti-inflammatory diet could be good. Someone asked here, are there any nuts that you should avoid? I've had people mention, oh, now I can't think of it, that almonds that have the skin on it would be not a good option. I forget the reason why now. That's a word that people say you should avoid, that I've heard people say you should avoid, but I haven't seen a lot of research that supports that. The almonds that I use have the skin on them. Some have the skin on them and some don't. But I have had more recommendation. I usually recommend people choose almonds, walnuts, and almonds, walnuts, and edamame is also, the soy nut is also a good choice for some people. Of someone listed maybe avoid walnuts if on levothyroxine. I had not heard that before, but it may be worth researching. I do like blueberries with my nuts because that has a good fiber and has a little bit of sweet for me. Yes, for me, weight gain has been it was a sharp increase too, and it is very difficult to cause a reduction. Is there possible to lose weight? I think yes, it is. And someone's mentioned that they've lost about 40 pounds. I've been losing weight about 40 pounds without trying. So a couple of things there is that weight certainly can come off, but when people are losing weight and it is not planned and it's large volumes, that's probably worth sharing with your healthcare provider too. Strength training for almost 30 years, lived a healthy lifestyle. Yes, I did strength training for about 10 years prior to menopause, which I am thankful for because maybe it helped to save the amount of weight that I gained, but it did not prevent it from happening, unfortunately. Let's see. Keeping in mind that um, hunger could come depending on what foods you're eating. So the more fiber-rich foods will be better choices of helping to keep you full for a quicker period of time. Let's see. Trained for about 30 years, healthy lifestyle. I think that's what I'm doing yoga that helps with flexibility as well as helping with relaxation. That's something to keep in mind for sure. Let's see. We have losing weight 40 pounds. Great. Excellent. So let's go back down and see if there's anything that was added that I missed. Yes, control portion sizes on your nuts because it doesn't take long. It can be a munchy food. You know, you just eat it and it can be mindless when you're eating it. So you have to be cautious when you're eating nuts. It's usually about, or I pre-portion mine out to about a quarter cup. And I know that when I'm past that, I reach my caloric threshold for that serving, and I have to kind of top it off. Even though, yeah, I find myself still going back to it. I have to really be cautious because you can really it can add on to the calories, nuts can. Awesome, awesome. So, ladies, and I am to the end of the things that I wanted to share. Are there other questions that people would like to put in the chat before we prepare to close? I do think, and I said this at the end of our last webinar, that that it may be a good idea to bring our male counterparts to the conversation because I think they may need some additional information around how um, to care or love, how about that? How to love us during this time because I think they are having challenges too. Yes. I think they can have challenges too in helping us and us helping them to understand how they can help us through our journey. But the lack of knowledge could certainly lead them to have some confusion for sure. So the last slide that I have up here is my contact information. So feel free to reach out to have a more detailed conversation about your hormones if you like. And I would say certainly stay tuned for another webinar. Keep a check on your portal accounts, that those people who are already advanced care patients for the next webinar to come. I don't have a date for it yet, but we do know that this is not the end of our education around hormones and our experience through menopause. There's many more topics to touch on, and I am anticipating on having another webinar in the future to, to go over more things. It likely will be a survey that comes out that will allow you to list things that you may have concerns about that you may like to have addressed in our next webinar. Excellent. Ladies, I hope you have a wonderful evening. Get great sleep tonight as best you can because it's going to be important to help you deal with the things that we have to deal with tomorrow. And we want to make sure that that helps us mitigate our stress. Great sleep. Have a great night. Thank you.